Hello everyone. Let's study a new chapter. It's about antiepileptic drugs. In some textbook, it's also called by anti-seizure drugs. It means this drug can be used to treat epilepsy seizure. Epilepsy occurs in approximately 1% of the population. Antiepileptic drugs are effective, at least to some degree, for about 80% of the patients. Lifelong treatment may be necessary. Epilepsy is a chronic disorder characterized by recurrent seizures. Epilepsy is an assortment of different seizure types and syndromes originating from several mechanisms that have in common the sudden, excessive, and synchronous discharge of cerebral neurons. Epilepsy seizures are resulted from abnormal discharge of cerebral neurons. For normal people, the discharge of cerebral neurons are like this. It's one by one. But when the patient with epilepsy attack, this is a synchronous discharge of cerebral neurons. This is abnormal. So during this attack, we usually can record the EEG, abnormal EEG, during seizure like this. Before seizure, the EEG is like this. There are several features of epilepsy. Epilepsy are recurrent unprovoked seizures. It usually temporal motor function or sensory function or emotional disturbances. And epilepsy usually accompanied with changes of EEG. For the normal people without epilepsy, the EEG is like this. For the patients with petit mild epilepsy absence seizure, EEG is like this. For the patients with chronic grand mal tonic-clonic seizure type, it is like this. So this the EEG are abnormal. The cause of epilepsy is the full range of neurological disease, from infection to neoplasm and head injury. In some subgroups, heredity has proved to be a predominant factor. When no specific anatomic cause for the seizure, such as tumor or neoplasm, is evident. When no specific anatomic cause is evident, a patient may be diagnosed with idiopathic or cryptogenic epilepsy. It also caused by primary epilepsy. Actually, in most cases, epilepsy has no identifiable cause. It may be triggered into activity by any of variety of environment factors, including alteration in blood gases, pH, electrolyte, blood glucose level, sleep deprivation, alcohol intake, and stress. Before I introduce the drugs, I need first to introduce the types of epilepsy, because in the clinical practice, for different type of epilepsy, usually they require different drugs. So the classification of seizures broadly divided into partial seizures and general seizures. Partial seizures, usually the abdominal discharge just locates in the local cerebrum. So the problem is just in a certain part of half cerebrum. Even spreading of this abdominal discharge also locates in a certain area of cerebrum. The patient usually has some functional disorder. This functional disorder occurs in a single locus in the brain. The patient doesn't totally lose consciousness. And the simple partial seizure, the electrical discharge doesn't spread. The patient often exhibits abdominal activity of a single limb or muscle group that is controlled by the region of the brain experiencing the disturbances. And this simple partial seizure may also show sensory distortion. I also have a video to describe to show you how about this simple partial seizure. Look at this boy. This is just has a abdominal discharge of about the choosing movement. Okay. You can see again. Just the abdominal choosing movement. And at the same time, this boy knows he has a seizure. This is simple partial seizure. Some seizures are complex partial seizures. This type exhibit complex sensory hallucinations, mental distortion, and the loss of consciousness. Usually consciousness is altered, but not totally lost. Motor dysfunction may involve choosing movements, diarrhea, or urination. And the simple seizure activity may spread and become complex, and then spread to a secondary generalized convulsion. Sometimes these complex partial seizures are also called by psychomotor attack. These simple partial seizures usually may occur at any age. Generalized seizures may begin locally, producing abnormal electrical discharge throughout both hemispheres of brain. It usually just occurs from a local area, but it can spread the whole cerebrum. So often the patient has an immediate loss of consciousness. And the generalized seizures also subdivided into several different types. It includes tonic-clonic seizures. It also caused by grand mal. I also has a video to show you what is this type. Grand mal. Now look at. This is tonic-clonic seizures. This boy, now, he has no attack now. Now look at it is starting. Beginning, tonic, first tonic. It means the muscle flex group continuous contraction followed by clonic. This is clonic period. During this seizure, the patient loses consciousness. This is tonic-clonic seizure. It also caused by grand mal. Another type is absence seizure. It also caused by petit mal. This type is a brief, abrupt, and self-limiting loss of consciousness. The patient stares and wave discharge seen on electroencephalogram. The patient usually stares and exhibit rapid eye blinking. This rapid eye blinking usually lasts for 3 to 5 seconds. Now look at, I also have a review. Look at this girl. Now she is playing a windmill. She is normal now. Now she stares. At this moment, she loses consciousness. But this seizure attack just lasts for several seconds. Very soon recover. And during this absence seizure, there is a distinct 3 per second spike and wave discharge seen on EEG. And generalized seizure also include myoclonic seizure and febrile seizures. This is caused by fever in very young children. And status epilepticus. I have explained this. What is this seizure type? It means tonic-clonic seizure, grand mal, continuously attack. And during the interval time, the patients also lose consciousness. If these conditions last for about 30 minutes, this condition is caused by status epilepticus. Actually, it is one emergency. Requires some drug therapy immediately. Yeah. Okay. Just now, I mainly introduced this disease, epilepsy, different type of seizures. So, what drugs are anti-epileptic drugs? Do you know phenytoin sodium? Let's go on. Why the patients with epilepsy has different abnormal discharge from neurons? Actually, the exact cause still is unclear. Just there are several theories partly explained, like GABA theory and excitatory amino acid theory. This theory is because it means the abnormal discharge of the neurons on CNS. It is related to the imbalance between these two amino acids, two kinds of amino acids. Usually, excitatory amino acid function increased, but inhibitory amino acid function is relatively reduced. So, by enhancement of inhibitory GABAergic impulse, it is effective to control epilepsy seizure. And the interference with excitatory glutamate transmission, some drugs based on this mechanism also effective. And the discharge of the neuron cells, it also related to the ion channels, especially sodium channel. So blockade of voltage-gated channels Based on this mechanism, some drugs are channel blockers. They are also very effective in the control of these seizures. Now look at. So anti-epileptic drugs can suppress or lessen epilepsy seizure by acting on neuron on the decrease over discharge, or they can act on the normal tissue around the focus of abnormal discharge of neurons and then avoid the spread of abnormal discharge. So based on this mechanism, they can use to treat epilepsy. The common anti-epileptic drugs include different agents. I should tell you, in this chapter, no one agents can be considered as the representative drug, similar to local anesthetics, because different types of seizures requires different agents to treat. And these drug names highlighted in red color, they are more important. Okay, let's study one by one. Sodium phenytoin. This drug, it is a strong alkaline. pH value is relatively high, so it has relatively higher strong irritation when they are used, especially at the local area of administration route. And these drugs are sodium channel blockers. Because of the blockage of sodium channel, phenytoin sodium are very effective to control different types of seizure, including random-eye, partial seizures. Actually, in the treatment of random-eye and partial seizures, it is the first selection. Now pay more attention about this. What type, which drug is the first selection? You should pay more attention to this. This is more important point about anti-epileptic drugs. You know, random-eye, it also means tonic-clonic seizures. You know, tonics, it is a period of continuous contraction of the skeletal muscle. And clonic, it means rapid contraction and excitation of skeletal muscle, that period. So for this random-eye or partial seizures, phenytoin sodium, it is the first selection. But in the treatment of absence seizure, it is invalid. You know, absence seizure is more occurred in young children. And it just lasts for several seconds. It's very special. It also has a specific EEG. It is usually caused by T-type calcium channels abnormal function. And this drug, phenytoin sodium, also can be used to relieve peripheral neuralgia, trigeminal neuralgia, and glossopharyngeal neuralgia. This neuralgia is also related to abnormal discharge as a local area of the neurons. So, is this blockers of sodium channel, it is useful. Phenytoin also can be used to treat tachyarrhythmias. It usually means arrhythmia, ventricular arrhythmia caused by cardiac glycosides intoxication. In the treatment of these tachyarrhythmias caused by cardiac glycosides intoxication, this drug also works as the first selection. Yeah, when you study anti-arrhythmic drugs, you will study this again. And also, when you study cardiac glycosides, this drug usually used to treat congestive heart failure. They has relatively narrow safety margin, very easy to induce cardiac intoxication, especially ventricular arrhythmias. So once that is tachyarrhythmia caused by cardiac glycosides, for that, phenytoin it is the first selection. Actually, I mentioned for the treatment of epilepsy, many patients requires a lifelong treatment, very long therapy. So you should pay more attention about the pay attention to the adverse reactions of them. If you are a doctor, suggest the patients to pay more attention to these adverse reactions. You know, just now I said, phenytoin it is very strong alkaline. Just because of this, it has a very strong local irritation. So it cannot injected intramuscularly. When it is used, it often induces some dose-related toxic reactions because it is sodium channel blockers act on the cardiac cells and the blood vessels. It may be induce arrhythmias. Yeah, in the past I also mentioned anti-arrhythmic drugs. They all has a latency to induce a new arrhythmias, including phenytoin. It also maybe induce hypotension, nystagmus, diplopia, or ataxia, because when it induces intoxication, it often affects the function of cerebellum and the vestibule. When it used for lung therapy, it is usually induce chronic tonic reactions, including nervous system reactions. These toxic reactions also means these toxic reactions, nystagmus, diplopia, and ataxia. And some patients, about 20% of the patients with the treatment by phenytoin, 20% patients have gingival hyperplasia like this. So it often it is necessary to suggest the patients to take vitamin C to reduce these adverse effects on the gum. It also is helpful to massage on gum, to inhibit this gingival hyperplasia. It is helpful at the local area. Massage on this local area. Yeah. Or take vitamin C is helpful. And some patients also have in some patients it also induces low folate levels, even lead to megaloblastic anemia. For this megaloblastic anemia, you can suggest the patients use this formal tetrahydrofolic acid to correct this anemia, because this phenytoin can affect the metabolites of folate. Some patients maybe also has hypersensitivity reactions. Usually it is not very serious. And for the pregnant woman, maybe it also leads to teratogenicity. For the fetus, it affects the development of the fetus, induce fetal hydration syndrome. This syndrome exhibits a small head, mental retardation, squint, ocular hypothyroidism, cleft palate. So for the pregnant woman with epilepsy, suggest the patients not use this phenytoin to treat. Try to avoid these adverse effects. So usually in the treatment of epilepsy, it requires a long-term therapy. So try to avoid these adverse reactions, and maybe it also affects the hepatic function. Suggest the patients to test blood, to make a blood test or hepatic function test, a measurement. Try to avoid the serious adverse reactions. Okay, just now I introduced the phenytoin. In the treatment of grand mal and simple seizure, it is the first selection. It also used to treat neuralgia, even tachyarrhythmias caused by cardiac glycosides. So how about other anti-epileptic drugs? Welcome back, let's go on. Next anti-epileptic drugs is carbamazepine. This drug can block sodium channels, and it also can inhibit high-frequency repetitive firing. And enhances postsynaptic action of GABA. It is similar to phenytoin. It also can be used to treat different type of epilepsy. It's more wider. It also can be considered as a broad spectrum anti-epileptic drugs. It also used to treat grand mal, partial seizures, similar to phenytoin. For these two seizures, it also can be work as the first choice. Even for the petit mal, it also is effective. For complex partial seizures, it also is effective. Just now you studied phenytoin in the treatment of petit mal, absence seizure. It is invalid. It can be used with phenytoin in many patients who are difficult to control, because it also can block sodium channel. It also can enhance postsynaptic action of GABA. And this drug, in the treatment of neuralgia, is also effective, even better than phenytoin. And in the treatment of mania, this is a kind of mental illness. It also is effective. This is carbamazepine. Another sodium channel blockers, phenobarbital. It is one barbiturates you have studied, sedative and hypnotics. It can inhibit the spread and the surprise firing from the foci. In the treatment of grand mal and the status epilepticus, it also effective, including partial seizures. It's also effective, but it cannot work as the first choice. In the treatment of petit mal, it also is invalid. Isosaximide. This drug mechanism of action is related to inhibiting T-type calcium channels. This T-type calcium channels is related to 3 Hz abnormal discharge of petit mal. I mentioned absence seizure on EEG. It often can be recorded a specific 3 per second spike on the wave. This specific EEG caused by petit mal. And this specific EEG is caused by 3 Hz abnormal discharge of pitted male. So it is related to T-type calcium channels. So this type of calcium channel blockers, isosuccinimide, is very effective in the treatment of this absence seizure. Actually, it can be work as the first choice, but actually it is just relatively better than the other agents because it has relatively less reactions on the tolerance. But it is not the most effective to control absence seizures. Just because of less adverse reactions, it can be work as the first choice. Sodium valproate. This agent can inhibit the spread of abnormal discharge by enhancement the function of GABA and inhibition sodium channel and decrease the calcium influx of T-type calcium channels. Based on this T-type calcium channel blockade, this drug you can understand in the treatment of absence seizure, it also is very effective, even more potent than isosuccinimide. But it cannot be considered as the first choice because of hepatotoxicity. I explained because this type of seizure usually occurs in children. It has hepatotoxicity. It is not safe enough, especially for children. But because of multiple mechanisms, it also used to treat grand mal and but compared with phenytoin and phenobarbital, it is not very good. Similar to carbamazepine, it also considered as antiepileptic drugs with broad spectrum. Different type of seizure, it is effective, even absence seizure. So grand mal, pitted mal, this sodium valproate is effective. That's why in the treatment of grand mal with pitted mal, this mixed type, it is the first choice. Phenytoin in the treatment of absence seizure, it is invalid. Isosuccinimide for the grand mal, it also is invalid. But sodium valproate, it is effective for both. So it is the first choice at these conditions. Benzodiazepines, sedative and hypnotics, include several different agents in this family. They are also used to treat epilepsy, especially diazepam, remember? In the treatment of status epilepticus, it also is the first choice. Nitrazepam, this drug is effective in the treatment of absence seizure and myoclonic seizure. Clozapam and clobazam, they are also anti-epileptic drug with broad spectrum. For the absence seizure and the myoclonic seizure, they are better. Okay, there is a table. It is a summary about these drugs and types of epilepsy. I cite different type of epilepsy usually requires different drugs. Now look at grand mal. In the treatment of this generalized tonic-clonic seizures, these two preparations are the first choice. In the treatment of partial seizures, these two preparations also are first choice. Phenobarbital also effective. These two agents also are effective to control grand mal. And these three agents are effective to control absence seizure, but isosuccinimide, you know, they this type and the drug are highlighted in blue color. This is the first choice for peptidamine. And this sodium valproate in the treatment of both granamyl and peptidamine, it is effective. So for these two types, mixed types, it is the first choice. In the treatment of status epilepticus, diazepam, intravenous injection of diazepam, it is the first choice. And these two agents also are effective to control this type. Okay, that's all for this section. So these drugs in the treatment of epilepsy, usually it requires a very long therapy, even the whole life. So what are the principles of clinical uses of anti-epileptic drugs? And do you know anticonvulsant drugs? Let's go on. The principle of clinical uses, I mentioned several times. The type of medication utilized for epilepsy is dependent upon the type of the seizure. There are so many agents of anti-epileptic drugs. It had better to use only one effective agent for the simple seizure, from low to moderate dosage. Otherwise, we must pay attention for the adverse reactions induced by interactions between the drugs. This therapy usually is very long, so stop medication gradually until 2 years later after the signs disappeared. So many patients requires a long therapy, even whole life. Once the symptoms of epilepsy, the seizure episode disappeared for more than 2 years, and that's conditions, it is the time to consider to stop medication. But this withdrawal, usually it is also a long term. It is a gradual withdrawal. And take care for the toxicity during long time medication, especially for hemogram and the liver function. So suggest the patients to go to the hospital to make the measurement of hemogram and liver function. For the pregnant woman, should be cautious about anti-epileptic drugs because of teratogenicity. Which drug induced this? Remember? Phenytoin. Yeah. Okay. This about anti-epileptic drugs. Let's go and study anticonvulsant drugs. I have explained what is the convulsion. Convulsion caused by over-excitation of seeing eyes. It caused by strong contraction of skeletal muscle. Every pieces of skeletal muscle contract caused by over-excitation of seeing eyes. It usually occurs in several different conditions, like infantile hyperpyretic, in very young children with a relatively serious fever, even and eclampsia. Remember this? And tetanus and grand mal. Actually, this is a type of convulsion. The commonly used drug to treat convulsion include barbiturates, benzodiazepines, chlorohydrate. You have studied these three groups. So here we mainly study magnesium sulfate. in the treatment of convulsion, magnesium sulfate administration route should be intravenous injection. It can inhibit the central and peripheral nervous system after intravenous injection and induce skeletal, cardiac, and vascular smooth muscle relax. So blood pressure also decreased by magnesium sulfate. And sense and consciousness also can be lost. So this drug, intravenous injection of magnesium sulfate, usually used to treat convulsion and hypertensive emergencies, especially eclampsia. Eclampsia, it is a specific convulsion occurs in pregnant women with serious maybe hypertension. So this drug also decreases blood pressure. So actually, to control that, to prevent, even treat the eclampsia, magnesium sulfate can be worked as the first choice. Okay, that's all for this structure. To help you review this content, I also give you several questions. I give you that table. It is the list of a drug of choice for different seizure. Sodium phenytoin, adverse reactions, applications, and anticonvulsant drugs include this. Okay, and these are terms about this epilepsy and the drugs. Okay, that's for this part.